G'day everyone, so my name was Dr. Bentley Logan. I'm the candidate with the Liberal Democrats Party. So people are asking me, well, why are you actually going into politics? Well, I've been working in medicine for 10 years now, since I graduated from James Cook University. The issues that I've been seeing over this last 2 years that made me have the most concerns was the fact that individuals, not the collective nation, but when individuals come with a problem, they're coming to the doctor. And when I've been in that position, I'm trying to come up with a solution. The solution has already been predetermined what someone has to accept. The issue that I have there is that many people don't want to accept a decision that's been made for them. They want to come to a decision of patient-centred care, what they want. Very important for that aspect there. So that's where I've been seeing too much issues of the government encroaching into private life at home, private life in business, private life anywhere. The issue that comes from there is that I look, well, which political party is actually going to push against this? I heard already today, Liberal and Labor, what are they going to do different? It's the expert health advice. It's the expert panels, those that you don't vote in. You can't question them as well. How do I know that? I've taken them to court as well. I've actually taken the Chief Health Officer of Queensland, in the state of Queensland, in the Supreme Court over the borders that we had between the states. That wrecked everything. Why was it we were discriminating between two classes of the population? Someone who's vaccinated, someone who's not vaccinated. The unvaccinated must go into quarantine. The vaccinated just crossed over with a PCR swab. Created havoc. Made no sense. Because you're going to be still transmitting, as we know. So it made no sense to have a financial repercussions to other individuals in society. So I looked as to who else is going to stand up for this. No one. So I take them to the Supreme Court, and what happens then? They change the policy within 48 hours of the court case going to be heard. Just open the borders up, no question. They should still be closed until now and going on the borders. Why would they change that? They would only change it so they didn't have to answer any of the questions. So how is it then when patients come to me and they say, why is it that I have to follow these orders? Who's telling me I have to follow these orders? Those expert opinions, you cannot question. So the only way that can be questioned is to change the legislative power that they have. The Chief Health Officer, he doesn't have to answer any question because the policy was changed. Wow. Like, that's all it takes. Just open up, move on to the next issue. It makes no sense. So how are we meant to keep people accountable when we're saying we want to have these external groups that's going to do all the independent, auditing? You can't even question them if they're going to change the policy. So the Liberal Democrats have, it's maybe not as popular here at the moment, but freedom from COVID alarmism. First thing there, end mandates. The mandates, you can have your choice. So this is where the next key point comes for me, is that it comes back to individual choice. You want vaccine, you have vaccine. You don't want vaccine, you don't have the negative financial implications of that. You don't lose your job, you don't have to fight as an individual against the system. We've already had safe work. They looked into that aspect. You have one dissenting judge out of the three. They turn everything upside down because of that. You've got doctors then and they say, oh, we can't get proper consent. No, you can get proper consent with what you're being told to consent with. So we're very clear there that the individual has the final say at the end of the day. No one is forcing anything on anyone. The individual chooses, but the individual has to be able to get the information that they want. I hear Kate speak today about the external groups that's influencing a lot of decision. Why can't we hold them accountable here? We can't. And it's not just me that knows these concerns. So I've been a doctor for 10 years, working in the hospital system. I was working in the hospital in Sydney Eye as one of the eye doctors. I was working before up in John Hunter Hospital as one of the only eye doctors up there. I noticed the problems that we had where we weren't even allowed to protect ourselves initially with wearing a mask. You had to have the mask ripped off you because it was causing concern to the public that they couldn't wear a mask. Made no sense when you wanted to protect yourself. I then go into the emergency department. We start seeing some of the first patients that got concerns with vaccines. Did they have their conditions registered? No, we weren't told that we fill out the therapeutic goods administration forms. So data is always skewed. The issue comes there is that can still happen inside, but individuals who don't want to participate need to be supported. So the Liberal Democrats are not just a freedom party. They're not just going for freedom from COVID alarmism. They're going really to support the economy. The main big things with the economy is that the debt is over $1 trillion where we're going to. Some of the main big policies we're going to say is, well, what are we going to do? We've got so much natural resources in Australia. So much natural resources. But why is the government having to have such large budgets? First thing we get in power, 10% take off the budgets of all government departments. And then also we're going to be reducing a further 1% every year, except for defence. Defence is not touched. You next will have the aspect that with your income, $40,000, tax-free. Tax after that is at 20%. Business tax, 20% as well. I'm hearing aspects about energy. Energy is going to be focusing on coal. There's going to be aspects there with nuclear. There's also the aspect that there's no net zero targets that we're going to embrace or renewable energy targets as well. So we're up front with that. I don't need that question as well. Defunding the ABC as well as the SBS. So we're up there. You can look at the Freedom Manifesto. It's got everything listed in there in our document as well. The 10 main points there is the fact that it allows individuals to choose how they want to live and what they want to do, and revert the fact that we don't need the government to be in every single aspect of life, especially with a coming technocratic state and the problems of digital identity, which is linked with every aspect. Won't affect all of us in here as this room. It's, as Kate's mentioning as well, it's for the children and how they grow up in this society. And the society that's going to be dictated and mandated to you to comply with, not just within Australia, but internationally. Now, there's no reason for me to have to come up here and sort of go on about these concerns. I just can stay in practice, do everything I'm doing, allow people to make their choice. But the issue I have there is that the individual cannot choose at this stage. So if you want to sort of vote for freedom, there's many freedom parties out there. We've been speaking at events actually for the last month. Pauline Hanson's One Nation Party, the Informed Medical Options Party, and UAP, with myself here as the Liberal Democrats. We've been speaking for a month. We've had over 100 people attending our events. It's also great because I have a beer and a chicken schnitzel as well and can relax back. But the point there is that on the Central Coast, many businesses have gone out because they just don't have the funds to do it. Regulation was mentioned before as well. Yes, we want less regulation in business as well. You want it so that you don't have to have so much startup costs. Then you can have actually people having businesses and not being taxed so much. You can have more people on part-time job or their jobs and they don't have to worry about the fact that they get the 40,000, no tax. You can have more subsidies. No, you don't have to be waiting on subsidy because you have more money to weather things yourself. So I really would recommend having a look at the Liberal Democrats website. We're not the Liberal Party, which is the other question that always gets asked to us as well. We've actually been taken to the High Court by the Liberal Party because we've got the word Liberal in our name. So you might want to look into that aspect there as well. But there's many aspects that with the party is going to support you as an individual so that you can decide how you want to live your life.
There's so many things I disagree with that I could ask or say, but I'll just stick with one, which is you seem to, I don't know, say the word individual, I don't know, about maybe 15, 20 times, and it disturbs me because we live in a society, we live in a community.
Has a right to live their life how they want to live.
Yes, you also have duties, well. You have responsibilities as well as rights, and I think it's really important not to forget that side of the equation, the responsibility side.
And which would be a specific example there, which you would have there about someone?
Well, there's so many, but one is the vaccination thing. I mean, you're saying that it's, from what I understood, you were saying it shouldn't be mandated, a vaccine. So what I wonder is, how bad does a disease have to be before you say it's okay for the government to mandate a vaccine or exclusion from the rest of the population?
The wonderful thing that we have is that we are a party that supports free speech, so we can actually openly have these discussions. These discussions haven't openly been had. We've had the ABC, which has basically been serving as propaganda with one narrative that bees promote to everyone. That's true, because otherwise we would not be having the dissenting voices of other experts from around the world to give a different viewpoint to individuals as well. So that's the benefit of free speech, that you can say anything you want, of course, but there's repercussions and consequences for anything you say.
Okay, so can I just clarify then, are you saying that this pandemic we've just had is not that bad, or are you saying that it is that bad, but people should still be able to do what they want to do and not be excluded from the rest of the population?
Party policy is freedom from the COVID mandates, which would be negatively affecting individuals. So that's where the party policy stands. So it's from having no mandates to be implemented against individuals where they're going to have negative consequences.
So I didn't
The
quite
party
understand.
policy, so this isn't an individual aspect upon what I'm saying as an individual. The party policy for the Liberal Democrats is for no COVID mandates. Opening up borders, not allowing it to have that governments can force an individual to have the vaccine so that they can maintain their employment, keep paying their home loans off, and have their kids go to school just by complying with the government mandates.
But what is the policy on people who are, have underlying health conditions, or they are more vulnerable to this pandemic? What is the policy around them?
Well, the policy, once again, is no COVID mandates, but it comes back to the fact that you have focused individual protection for groups that are high risk. Now, those are many protections there that still is, in fact, now here. The fact that you get a vaccine if you are high risk, if you have multiple comorbidities. You don't have, though, the media telling you that the virus doesn't discriminate. You don't have those aspects in there. So that's where I've got a lot of concern when individuals have come to me who don't want to have the vaccine, they're losing everything, they've got legitimate questions to be asked, and they've got no avenue to ask those questions. Do they have $250,000 to go to the Supreme Court? No, they don't. And then to appeal it in the High Court in terms of this specific aspect you have there? I mean, there's a lot of people that have lost everything at the moment just because they haven't complied. The issue that you have there is that if you comply, everything's opened up with privileges. And your privileges has a timestamp on it, as we've seen. Why is it the nurse comes, she doesn't want to have a third shot, and now she has to lose her job and she just sold her house? Makes no sense. She even had COVID. The ATAGI guidelines are saying that you could have up to 4 months, but then New South Wales says no, only 6 weeks. And now they've changed once again with the guidance. The guidance is there, but unless you follow the guidance, you're outside. And then you can't even stand up to give private medical advice to an individual and support their questions. That's why people are leaving their GPs. And there's already a GP shortage here on the coast, as we hear, but I don't know how we're going to fix that, because as soon as you go from the hospital service into GP, you take a massive pay cut. It's almost 30% is what you're losing there to go in general practice. And you're going to do that for a few years of your training, and you don't get the better training time compared to the hospital doctor? Where's the incentive to go into general practice? It's not there. I support individuals in general practice because when you come to the GP, you're choosing what doctor you want if you have that ability to. But not everyone has that ability to. That's why we have Medicare that gives us the ability that we can still have access to health services. But the issue that comes is that most individuals, if they want to find a solution, what they want to work on as an individual outside of the main guidance, they should be able to ask those questions. For the last 2 years, they have not been able to have those questions answered or even asked.
I think the point's been well made.